Hey, folks, we're back. It's 11 o'clock. We took an hour break. We hope you're here to join us. We just posted on Facebook. I'm your host, BKP. Good morning from the office, North Georgia's only live online morning show. If you have information, there is the phone number. There is the email address. If you have information that you would like to pass along, get to our website. Now, at 11:15, if you're just tuning in, we're going to have Dr. Raymond Tidman. He's with Fannin County. Fannin County has one reported case. Dr. Tidman will be with us at 11:15. We'll be doing this segment with him. And what we will do is the same thing we've done on our YouTube channel this morning is we've put that up again, our information. This morning when we opened our show at 8 o'clock, we had 3 guests this morning. There's been state of emergency put in place for several of the area counties in North Georgia. Gilmer has done one. Pickens has done one county. Fannin plans to do one. They plan to do one in Fannin here for the Board of Commissioners at 4 o'clock today. City Council is meeting at 3. So a lot of moving parts today. And what we've been trying to do is get you, the viewers, the information on what is a state of emergency. How is it enforced? Is somebody going to go to jail? Who's essential? Who's non-essential? And one thing after another. So we're going to have Dr. Tidman now. I want to give a shout out to Sheriff Donnie Craig at Pickens County. He called me at 7 o'clock this morning as I was trying to set up today's rotation to get all the information out, and he wanted me to express to Sheriff of Pickens County, Donnie Craig, that he just had a long list of things that had to happen. They have 4 cases at Pickens County right now, 4 live active cases of COVID-19 coronavirus. So he is busy, but he wants to talk to the citizens. He said he would text me the minute he's available. So within the hour that we're going to do this program, if he comes available, we're going to get Sheriff Donnie Craig. We don't know yet. But he is communicating with Fetch Your News and doing whatever to help get information out, and that's what we're doing. Okay, this morning we spoke to, you go to our YouTube channel, Fetch Your News, FYN TV YouTube channel. This morning we talked to Gilmer Chairman Charlie Paris, Pickens Chairman Rob Jones, and Gilmer Sheriff Stacy Nicholson. So those are on the website. Now we're going to get right here at 11:15. We're going to get Dr. Raymond Tidman from Fannin County on the line. He is our doctor that was on with us, Dr. William Whaley, Friday on Ask the Doc. So that being said, let's go on to a couple things that are happening. Okay, a couple things that are happening. And this morning I didn't get a chance to go through my pictures. I like to go through my pictures. So let's go through a couple of my pictures. I like to talk about how the media is, it's sad because I'm going to say this. All right. Let me find the picture I want. Okay. Give me number 27. And let me talk directly. I'll just say people of faith. Okay. Let's go with people of faith. Now, hope. We sing praise music. You sing it maybe at church. My hope is in you. We talk about hope, okay? And Easter, if you're a Christian, I don't know, Christians on Christmas, we celebrate the birth of Christ, God sending his only begotten Son. That's whosoever believeth in him should not perish, but have everlasting life. So I'm not going religious on you. I'm really not, but let's just stay there. So on Christmas, we celebrate him sending his Son for you and I, if that's your belief. Easter, we celebrate the finality of it all the way around, the death and resurrection. And that the grave can't keep Jesus in the ground. Now, again, I'm not preaching, but that's what the death, the resurrection on the 3rd day, ascended to sit on the throne next to the Father. All right, and that's all the preaching I'll do. But That one's big. When I say big, that's the biggie, right? Easter. Now, if you want hope at a time of hope, in a time of a pandemic, in a time when it is probably the time to call on him, would be now. So yesterday, the president of the United States, who suggested Easter, right? That's what I find. That's what I find right here. Who suggested Easter? Now I think about that. Who suggested Easter? I don't think anybody suggested Easter. Okay. Well, I know what they mean by who suggested Easter should be the day. Who suggested that day? The president of the United States, I watched the town hall, and the president of the United States said his hope that we could worship together. Now, if that day of all days, you can't come together and worship, if that day of all days, now think about it okay? Now I want you to put it in perspective, okay? Let me go through these a little bit, okay? That's that one there, okay? Go to number 29. Number 29, they're trying to get a medical opinion. Dr. Fauci, open by Easter? Experts push back against Trump's call for U.S. to be open by. Experts push back. Number 32. Trump wants packed churches and economy open again on Easter despite the deadly threats of the coronavirus. Easter. Hold on. Number 38. These two are stunned and amazed. Number 38. Trump says he wants country open by Easter. Number 38. See if I can get. Number 43. Trump says he wants country open by Easter. Number 43. Hold on, I'm going to get one or two more that I want up that have to do with Easter. Hold just a second. I got them here. I want to get, you don't want to leave CNN out, right? CNN, number 68. Trump wants U.S. economy to reopen by Easter. Okay. Number 69, this young lady at CNN is amazed. But Mr. President, why Easter? You want to open it by Easter? Are you going to take the advice of your other people there about Easter? So that being said, and leave that last one up about Easter. Let me just say this. The government has no idea why Trump, the news networks, no idea, the media, why does Trump want to do this by Easter? Why medical professionals are against it? Why government must stay shut? You know, I think you ought to go read Pontius Pilate in the area of the Bible that deals with the crucifixion of Jesus. I think you should go read it. I think you should go read what the people were saying at that time. I find it interesting. President of the United States says we should have hope. And his hope is that we could fellowship and worship on Easter with nobody telling us we can't. I'm going to take a break. When I come back, Dr. Raymond Tidman's going to be on the line with us, and he'll be with us right after this brief break.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in Ellijay, Georgia. Our shop specializes in collision repair and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on-site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
North Georgia Diamond is your source for diamonds in North Georgia.
Ace is your healthful place for paint and home goods, tools, outdoor living, and lawn equipment. But did you know Ace Hardware of Blue Ridge is a little bit more? We have hunting rifles and accessories for your next hunting trip. We have Amish furniture imported directly from Ohio. And we have Ace Custom Woodworks for all your custom wood project needs, from cabinets to artwork. Ace Hardware of Blue Ridge. We have your new house in stock.
Okay, folks, we're back. I'm your host, BKP, and this is a special segment we're bringing to you today. We have been talking to so many different officials up in North Georgia concerning state of emergency that's been put in place in several counties in North Georgia. Right now, joining us on the phone is Dr. Raymond Tidman. He's from Fannin County, and he has his practice in Fannin County. Dr. Tidman, thank you for joining us.
Good morning.
Let's just go directly. We have one case that is reported on the CDC website in Fannin County that's a positive. Now, before I bring you in, Now, my understanding also, because I heard it in a press conference, it's against the law not to report a positive to CDC. Is that true?
Well, yeah, I mean, it's part of our obligations as practicing physicians to, particularly in a healthcare crisis, to keep the public health services up to date on what we're seeing. So, I mean, I don't know about the legality of it or whether a law enforcement officer would be involved, but it's just part of our obligation during these times.
I guess what I wanted to get to is if we're not seeing it on the CDC website and we're just hearing rumors flying around in social media that there's 2 in this county and they're not telling us, that's pretty much not true, correct?
Yeah, I think you can depend on their website. Now, I'm not saying that they're perfect, but I can't imagine a clinician keeping data away from them, whether they get it posted that day or the next day. I mean, that's kind of an administrative thing. So,
well, last night we reported on Fetcher News the first confirmed case in Fannin County. The first confirmed case that was tested in Fannin County. And last night, through social media messages, text messages, myself, my wife, and our reporters, we were inundated with who. Now, the medical field, you're not able to tell us who, but what kind of details can you tell us about a positive test?
Well, this case in particular was actually tested last week, actually a week and a day ago now. It's that long to get a turnaround. The individual does live up here. They actually have a full-time home, and they had been at a work conference out of state. So they had returned with upper respiratory symptoms and significant fever. And we did the proper isolations and tested them, and then had them go home and self-isolate. So the individual's fine now. And, I think all the relevant protocols were undertaken.
Okay, the individual is fine. So let me go with that. The individual is fine, not hospitalized. And like I said, I know you're limited what you can say, but I think these are the questions that people are having. Sure. If you test positive and your fever breaks and you go through the 24, 48, 78, 2 hours that this takes to run, you still have to, you can't just say, I'm over it and I can go out. Are you still a carrier?
Yeah, well, you should assume that. I mean, we'd like you, even like this individual needed to stay inside 14 days. If they were further symptomatic, let's say they got sick or they were in the hospital and stuff like that, we would be treating them and retesting them at some point before we release them into the public.
So you feel, but you tell us that if someone does test positive and they recover from this, they get through their fever.
Yeah.
If they follow the recommended 14-day quarantine, then after that should be okay.
Yeah. Or they should be fine. And, the majority of patients with this are going to be fine. And the case number is so small here now, the health department folks can manage these patients. I can just turn them over to the health department and they can make sure they're doing okay and they're following isolation procedures. They also do checks of other individuals that may have been in significant contact. So at this point in our county or in our region, this is quite manageable by the health department and they can run down all contacts.
All right. I think what a lot of people are asking is how do doctors, the health department, all working together with the counties. Now, my understanding is through the health department and some conference calls, counties have been encouraged to do a state of emergency, which they have to do that for the legal verbiage has to say state of emergency. But the understanding that I have is there's a concern about the strain on the local medical industry that we have available to us. And they're recommending, and counties are following suit. Are you, as a physician yourself, are you glad to see that these counties and cities are taking action as far as social separation, closing some non-essential stores down? What say you?
Well, I'm glad the public in general is getting educated about taking this virus seriously, and particularly about practicing, to be highly technical, not being a vector. That is, do behaviors that minimize the chance that you're going to be spreading your germs and stuff, regardless of what you know about them, on anyone else. So keeping a little bit of a distance, sneezing and coughing in the right way so that you're not spreading a lot of vapor around. If you are sick, stay at home. Don't go to work sick. If you are sick and you have to go out, wear a mask. If you're sick enough, call your doctor's office. I mean, those are all very important things. But I want to go back to something you and I talked about last week, because we are going to evolve into a different way of managing this. Now that we have data coming in, and we can start making really informed decisions, this virus will be around for weeks and months, and we'll know where the hot spots are, and we'll know how to more focus things that have major economic damaging effects. Nothing about this will change with regard to protecting those at risk. And, I use the term, treat your seniors like fine china. So I think one of the next levels of understanding we need to start getting in our heads is, how do we protect those that we know are highest risk from this? So that means if you've got an elderly parent, as we have in my office, I have staff that has elderly parents or a parent with cancer. Your contact with them has to drop off markedly. And when you are in contact with them, you have to use protection. So it's really a matter of mentally thinking about those people that you are around, that you have immediate contact with, and how you're going to protect them, because they're still going to be at risk for some time now, even as we eventually go back to living our normal lives.
We live in an area where a lot of people in the area have been here generations. So somebody is used to going by moms and saying hello before they go home from work, because that's just where we're at, and we just don't think twice about it. But those are the kind of things we have to think about now. Yeah,
and that's my point. And I mean, I don't want to be too ethnocentric, but I think we live in this area a pretty healthy environment.
Yes,
we're pretty spread out. We have lots of clean air and clean water, and we really care about each other. So right now, the real, I think, fine tuning we need to do is, how are we protecting those at risk, at highest risk, from our vapors, so to speak, for a while. So we just have to keep a little more space for them, and certainly, do a lot of good hygiene things. And that's where mentally we need to start turning this around and saying, okay, that's something I need to figure out and get straight for myself, and just get disciplined about it.
Let me just say this. There's been several media outlets, and I think you know who they are, that have tried to put division between the president and his staff, especially like Dr. Fauci and I'm embarrassed to say the lady. That's embarrassing. That's doing an outstanding job, but they're continually trying to drive a wedge between the president and his medical staff that he's consulting with. The president said yesterday he would like, and I thoroughly understand, millions of Americans want to go to church on Easter Sunday. I will just say the small joke is a pastor one time used to call some of them Easter lilies, because that's the only time they came out. But I'm sorry, maybe bad time. But Americans like to go to church on Easter Sunday. And the president said he would like for us to be back Easter Sunday worshiping in church. How realistic is that? What kind of concerns do you have?
Well, I mean, you've got to start putting a stake in the ground. You've got to start working towards it. It may or may not be that date, but they will have more and more data to drive these decisions with. So I'm comfortable with their decision process. Here's another good analogy, and I think it strikes home. Let's say that heaven forbid, in your family, one of your parents was stricken with cancer. I mean, everybody that in your family and your immediate close friends would be in the hospital with him or her day in and day out as that diagnosis was made and as things happened. At some point, you would have to say to family members who looked at you, I need to get back to work. You would nod your head and say, yeah, you need to get back to work. I'm here with mom, or I'm here with dad. That's what's happening in our country now. At some point, we have to go back to work, and we need to be supportive of each other and say, okay, who goes back and when and why? You got to go on with your life. We can't all stay at the hospital waiting for, the terrible thing to happen. And that's, I keep saying this.
No.
We live on a deadly planet, and we need to take care of each other. And I think that the media is quite disgusting about this. I mean, this is a real we moment for the country. And I think the country's coming together well, and people are paying attention, and they're learning, and they're shifting and doing things differently. And it's very hard.
Well, that's a very eye-opening way to look at it, Doctor, because I've experienced that myself with brothers and sisters in 2019 with a family member. And we actually were in the hospital. I live 1,000 miles away, and we were like, okay, who can do this? Who can do that? Who can stay? And, who has to get back to work? And I have a business to run. And I know what you're saying there. And that's somewhat where we're at with America on, like you said, putting a stake in the ground. So he put a stake in the ground, but we got to have something to work towards. And we're going to have to get back to work.
Yep. We're meant to work. I mean, that's where our vitality comes from. We're working people. Our self-esteem is in our work. Our purpose is greatly into our work. So, that's something we go back to.
Okay, I know you're busy, so I'll finish up with this, and thank you so much for being on. How when you say concern, we have one in Fannin County. What is your concern? Let's bring it to Fannin County, Gilmer, the surrounding region, Union. What are some of your concerns right now, and do we have the necessary items at hospitals and medical facilities to weather this through? And let me say this, because what everybody is saying, which I understand, is the data we read today is 5 days old because it's coming in today. So is this going to be worse next week? And what should we be doing in North Georgia? And what's your concerns in our area?
Okay, so that's a good question. Let me point to it this way. The skyrocketing things you're seeing in New York, part of that skyrocketing thing is that they have the tests rolling out and they're testing people. So the rise in the number of cases in New York is the rise in the number of tests in New York. It parallels those two. They're just now finding these cases. These cases have been there. Now they're finding them. We still do not have the denominator to this thing. How many people are walking around with the virus? There are some good little pockets of data. One of the cruise ships where they had the major outbreak, they tested everybody on that cruise ship, and it turns out that of half of all the positives that were positive for coronavirus, half of them had absolutely no symptoms whatsoever, not even a cold. So there are a lot of folks who are going to be walking around with this virus. And as we figure that out and go back to our lives, I'm going to go back to my original statement. We have to learn how to protect those at risk. And who's at risk? The very elderly and people who have comorbid problems like advanced diabetes or complications of cancer, chemotherapy, or any immune suppression. So that's where we're going to learn something different as a society, and that's a good thing for us to learn. One other point you asked about is the state of the county. I have no doubt that all the physicians and caregivers in our area, in the nearby counties, are highly tuned into this. I must get 4 or 5 emails a day from each of the hospitals I'm associated with about the state of the hospital. I called the administrator in anticipation of your call, the local administrator here. We have more testing available. We have more coming in. We have tests now that can be turned over in a day or two. So our testing locally is getting better. And the main thing is, and then thirdly, that a lot of us are practicing more telemedicine right now, just to reduce the amount of people in the waiting rooms. So if I can manage a patient via telemedicine right now, and they don't need to come into the office, and it's a simple follow-up of getting some labs or getting some surveillance or checking on how they're doing, I'm doing it through telemedicine, as are many other physicians. So you'll actually see waiting rooms with less people in them right now, because we're trying to really keep those at risk protected.
Close with this. We see it on the internet. We're inundated with it, but you don't want people to just come and say, I think I'd like to get tested? You want them to have symptoms, number one, be symptomatic. And if they are, what are those symptoms?
So the answer to your question is correct. I mean, if everyone wanted to be tested, we'd have to have 350 million tests. That's just not possible. We have millions of tests, but maybe 1/10 of that at our best time. So no, everyone can't be tested. Now, who should be tested? Those who know they've had a contact, those healthcare workers that are at risk for contact, that we're trying to keep them at work and may have brushed into or been around someone. And certainly those with symptoms, high symptoms that are nearing hospitalization. So I think if there's any confusion about it, ask your doctor, ask your healthcare provider, and it's okay to be a little bit pushy. I mean, people are a little bit on edge. But if you are an at-risk person, in particular, you have comorbid problems, or you're advanced in your age and you have upper respiratory symptoms, you need to get tested. And so you call your doctor and figure out how to do that. We're not in trouble with limited tests right now. So, ask.
All right, close with this. If someone were to be, if someone tests positive, are they obligated to start researching who they've been around and notifying them within a period of time? Or
if they're positive, then we notify, and that investigation begins immediately.
Okay. All right. Thank you, Dr. Tidman. We appreciate you so much. We know how busy you are, and we appreciate you taking time out of your day to share this information. We appreciate you. Have a great day.
Thank you. Take care.
All right, folks, we've been on the line with Dr. Raymond Tidman, and Raymond Tidman, physician here in Fannin County. We're going to, this will be on, go ahead and put the information up. This will be on our YouTube channel, FYN TV, Fetch Your News, our social media. That's our phone number and our email address to get in touch with us if you have any information. We're going to go ahead and sign off the air. We were going to stay on till noon, but we're going to sign off because hopefully we're going to try to get Sheriff Donnie Craig, and he's very busy. He's not ignoring us. We know that. I've spoke to him. As soon as he texts me and says he's available, we'll try to get him on. But until then, we're going to sign off, and we'll see you when we see you. But follow us on social media, because that's where we're posting when we have somebody going to be live to update. So we'll talk to you later there, Destiny, and let's get this one up also.